Hello and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. The human brain, weighing just 3 pounds, is the most complex organ of the human body. It controls every thought we have, every movement we make, and every memory we cherish. Yet, in our fast-paced lives, we often neglect to take care of this vital organ as we do for our hearts and muscles. Brain health is not just a moment in time, it is a lifelong commitment. Neurological disorders remain the leading cause of disability-adjusted life years and the second leading cause of deaths globally. Yet many of these conditions can be prevented or better managed with early intervention, education, and equitable access to care. Today in Wellness Watch, we discuss brain health and prevention. I'm Preeti Kaur. Millions worldwide are impacted by brain disorders, from strokes to Alzheimer's. But what if you could take control of your brain health? Can lifestyle changes really prevent cognitive decline? How are innovations in technology and medicine transforming treatment options? Join us as we explore the latest breakthroughs in brain health and discover the answers to these questions and more. What's the key to a healthier brain and how can you start protecting yours today? Up next, we take a look at Sujata Lochib's report.
Just as our bodies need care to function optimally, our brains require attention to thrive. From thoughts and emotions to actions and memories, brain health encompasses it all. Yet, millions worldwide suffer from brain disorders that impact their daily lives. Brain health isn't just about preventing disease. It's about optimizing how we think, feel, and function every day. According to the World Health Organization, brain health is defined as the state of brain functioning across various domains: cognitive, sensory, social, emotional, behavioral, and motor. It allows individuals to reach their full potential throughout life, regardless of the presence of disorders. With over 1 in 3 people affected by neurological conditions, brain health is a leading cause of illness and disability worldwide. Some major health conditions that impact brain health are autism spectrum disorder, a diverse group of conditions related to brain development. About 1 in 100 children is diagnosed with autism, highlighting the importance of early intervention and support. Cerebrovascular disease, which includes strokes, hemorrhages, and aneurysms. These conditions are a leading cause of death globally and significantly impact brain health. Dementia is another critical concern. It results from various diseases and injuries affecting the brain, with Alzheimer's disease being the most common form, contributing to 60 to 70% of cases. Dementia is currently the 7th leading cause of death and a major cause of disability among older adults. Epilepsy, a chronic, non-communicable disease, affects around 50 million people worldwide, making it one of the most common neurological diseases. Migraine and other headache disorders rank 3rd in accounting for the overall neurological disease burden, following stroke and dementia. These conditions can severely impact quality of life. Parkinson's disease, which is rapidly increasing in prevalence, effective management through clinical diagnosis and simplified treatment guidelines can improve outcomes for patients. So what makes your brain healthy? Exercise is crucial. Regular physical activity slows age-related brain deterioration and maintains cognitive abilities. It also lowers blood pressure and helps prevent vascular diseases that can lead to strokes. Simple activities like walking or playing sports can make a significant difference. Mental exercises such as puzzles and strategic games are equally important for cognitive health. Sleep plays a vital role in brain function. Humans spend about 1/3 of their lives sleeping, which is essential for memory consolidation and overall brain health. Your environment also influences brain health. Exposure to environmental toxins such as pollutants in air and water can lead to neurological issues. Additionally, head trauma from accidents or sports can create long-term damage to brain cells. A balanced diet is essential for brain health. Finally, access to care is crucial. Availability of healthcare services and preventive programs allows for early detection and treatment of brain health issues, preventing further complications. India has made significant strides in neurology and brain health, blending ancient techniques with modern advancements. From the Ayurvedic understanding of neurological disorders to innovations like deep brain simulation for Parkinson disease, India is at the forefront of addressing neurological challenges. The impact of brain health extends beyond the individual, influencing families and communities. With advancements in research and healthcare, particularly in countries like India, we are better equipped than ever to address the challenges posed by neurological conditions. Sujata Lochab's report for DD India.
All right, what happens when a brain is not healthy? Can a person live long with a brain disorder? World Brain Day, observed annually on 22nd of July, serves as a call towards action for increased neurological health awareness and advocacy. In context of a rapidly aging global population, the burden of neurodegenerative diseases such as Alzheimer's and Parkinson's disease is rising, posing significant challenges to healthcare. Also, recent scientific breakthroughs reveal that our brains are not fixed, they can grow, adapt, and heal even through our old age. Today in Wellness Watch, we look for these answers. What is brain health? How can one maintain a healthy brain? What are the major health conditions that encompass brain health? What are the common signs of cognitive decline? And we also will look into what medical advancements have been made in India in this field. India offers a wide range of advanced treatments for various brain conditions, including brain tumors, stroke, and neurological disorders. Treatment options include surgery, radiation therapy, chemotherapy, and advanced techniques like stereotactic surgery and proton therapy. Up on your screens, we'll get you some hospitals and institutes across the country which specially cater to neurological disorders: All India Institute of Medical Sciences, Safdarjung Hospital, Delhi, Government Kilpauk Medical College Hospital, Chennai, KC General Hospital, Bengaluru. All right, to help us understand brain health better, we are joined in by doctors in the studio. We're joined in by Dr. Achal Shrivastava, Professor, Department of Neurology, AIIMS, New Delhi. And we're also joined in by Dr. Debashish Chowdhary, Director, Professor, Department of Neurology, GB Pant Hospital. Thank you so much, both of you, for joining us this afternoon on Wellness Watch. Dr. Chowdhary, I would want you to explain to our viewers in very simple terms, what is brain health? Or for that matter, if I put it in a different way, is it same as mental health?
No. It is not same as mental health. Mentation is one of the functions of the brain, but brain does a lot of other functions also, like cognition, like movements, like sensory perceptions. So brain health is a holistic approach, a condition where the brain remains absolutely in tune of the demands of the body to maintain a homeostasis for the person to survive in the environment, to function as normally as possible, to take decisions, to think, and to enhance and enjoy the life. So therefore, brain functions and brain functioning has got a wider spectrum, just like a mental health. Mental health is one part of the brain health.
All right, mental health is one part of the brain health. From here, I'll bring in Dr. Shrivastava. Dr. Shrivastava, what are the major health conditions that encompass brain health?
Yes, as Dr. Chaudhary said, it is not limited to mental health.
Well-being.
There are several, because brain does lot of functions, not only mental function. So, like major diseases which come into picture, they are like some degenerative diseases, which includes, of course, dementia, various kinds of dementia, Parkinson's disease. Then we have stroke, and then we have epilepsy. Then we have various headache disorders, migraines. these are some common brain problems which occur.
All right. These are some of the common brain problems, as sir pointed out. Dr. Chowdhary, for a person leading a normal life, day-to-day life, the life is going on, progressing very smoothly. When would a person know that there is some danger to his brain, or the brain is not healthy, if I would say that? What are the signs or symptoms, early symptoms or signs that one should look for?
So I think there are two aspects to it. One is the symptoms directly coming from the brain dysfunction, like your thinking process is getting altered, you are not able to pay attention, you are not so much smart as you shown in the caption, right? You are making repeatedly mistakes, which implies that you are forgetting, right? So these are the early symptoms that will suggest that possibly some cognitive changes are happening, and probably there might be an element of dementia in that. Secondly, if there are transient symptoms, like you suddenly become lack of vision, lack of sensations of one half of the body, or slight weakness happening, so we call it the transient ischemic attacks, right? So they are the harbinger of a major stroke that can happen. You are having a recurrent repetitive headaches which are happening again and again, or a headache which has happened suddenly out of the blue and it is very severe, which you call as a thunderclap headache. So that is a warning sign that something might be happening to your brain. The second part is the association of comorbidities. Like if you are getting hypertension, if you are getting diabetes, if you are a smoker, if an alcohol in consumption is too much, right? And if you have dyslipidemia, lipids are not good, you are having a sedentary life, and you have a strong family history of heart or brain disorder, then also you should be very cautious in having a regular checkup, so that these deficits which are actually going to affect brain in some way or other needs to be picked up, and adequate preventive treatment. So nowadays we are talking a lot about preventive neurology, So you need to prevent these episodes happening, and by looking at these comorbidities and estimating the risk that you have because of these comorbidities in you.
All right, sir. Do we have a specific age group, which is more prone to these conditions, these symptoms which you're talking of? How often do children also face these symptoms? Added to that, and when a child is born, is he born always with a healthy brain? And added to that, if I may ask, till what age can the brain of a child develop? Put all this together, how do you address these issues?
So I think that you have asked a very important question. That one of the chief conditions causing non-communicable neurological disorder is early brain insult to a newborn, right? And that happens because of the deficiency in the obstetric practices. The mother is not going and taking a proper ANC visits, or there are some genetically predisposing conditions, hereditary conditions, which are making the brain function less in terms of metabolism or the blood supply. These are the two important things. Either the metabolism, the glucose utilization of the brain is defective, or the blood supply is some way disrupted. Along with that, of course, the respiratory insufficiency. Many people do not, normally we ask that, did your child cry immediately after birth? A few minutes of delay of cry can cause a devastation in that developing brain. Now that brain, which is initially formed, is a very, very, delicate structure. It grows over next about, up to 10 to 15 years, right? So what happens that as the brain size increases, the layers around the neurons, which we call as myelin, they get started developing, and the conduction becomes faster and faster. So the child, as he grows, attains his normal developmental status by this development of brain and the myelination pattern that happens with age. Right? So there are diseases which are specific to very newborns. There are diseases, neurological disorders, which are specific for children, and there are disorders which are happening in elderly, like dementia, right? They are more prone, stroke, more prone. And then there is a middle group, the most productive lifestyle, that is 20 years to 60 years, where the headache disorders are very, very common. Migraine is very common, and that is now considered as the second important cause, the most important cause after stroke of causing disability to the patients. So, the age bracket depends on what type of neurological disorders you are talking about.
All right. I'll take that forward to Dr. Achal. Dr. Achal, sleeplessness, headache, forgetfulness, these are something which we face every day in our day-to-day lives, because
Yes.
given the fast-paced lives we are leading. When is it that a person should see a doctor? Is brain fogging also an early symptom of a cognitive disorder?
Yes, see, there are several diseases which we mentioned earlier, which occur as a neurological disorder. In that, they have various symptoms and signs. Like Parkinson disease has different signs and symptoms. Alzheimer's disease will have different signs. Epilepsy will have different signs and symptoms. So, all the headache, of course, migraine will have different signs of symptoms. So, accordingly, the population or public has to be aware of those symptoms. Some of them already Dr. Chowdhary has mentioned, like dementia is already mentioned, headache he has already mentioned. One thing which was that was epilepsy, where you have jerky movements, sudden jerky movements, or sometimes sudden unawareness for some time, and sometimes jerk-like movement, single jerk. Those things are different kinds of features which appear in patients. So, on most occasions, what happens, people come to the hospital because of disease severity. Symptom severity brings those patients to the hospital. But people who have already read from books, or people who have learned from programs, or read through some other means, radio and other things, they of course find out early features and then they come to the hospital. You asked about brain fogging. It is also, of course, one of the features which may have several causes, including may give rise to dementia later, but of course there are many other causes. So, I mean, again, you keep on asking, we'll be answering you whatever, because there are several diseases have different symptoms. Yeah.
Yes, when you talk of cognitive disorders, there are a number of diseases and symptoms as well. But then, Dr. Chowdhary, what role does genetics and family health history play in brain health of a person?
Right. I think that plays a fairly important role, and I think that should now be, that actually we are looking at in preventive neurology, we are looking at the impact of the genetic and the hereditary factors. Where, say for example, the persons whose family members, the fathers, mothers had stroke, they stand a more chance of having a stroke, because they probably inherit some of those metabolic factors which increases the risk of stroke, like hypertension, like diabetes or dyslipidemia. So something like that. But it is not a very large proportion. As of now, I think we can broadly divide the neurological conditions into two groups. One will be this non-communicable disorders, and one, there is in India still, we have a lot of communicable brain disorders in which the infections are major cause which can affect brain, like encephalitis, like meningitis, right? Those can also have a significant impact in terms of the affliction to the population and in terms of the overall symptomatology.
All right, Dr. Chowdhary had mentioned about the brain of a person, of a child, grows till 10 to 15 years, evolves, and can the brain cells of a person, mature person, be increased naturally?
Naturally, I don't think it will not increase. Usually there is a process, as the age advances, there is a process of degeneration. So it will gradually decrease. It doesn't increase in number as your age advances. It doesn't increase in number.
All right.
But
yes,
I'll make
you want to add this?
Yeah. So he's absolutely right, because brain is a post-mitotic structure. So after the cell division has happened, so it remains the same and it is encased within a skull. But what happens is that the synaptic connections might change, and that is the thing which we are looking at. The neurologists, neuroscientists are looking at how to improve those synaptic connections, the connections between the neurons. That might increase through learning, through training and all that. And therefore, there is a kind of a new branch that is coming, that we are talking about the neuronal plasticity. That the ability to form new synapses, new connections, so that even if the cells are little less, but other cells which are normal, they are able to take the function.
All right, Dr. Achal, is it true that a human being uses 10% of the brain all through his life and the remaining, say, 90% remains unused.
See,
Is it so?
it's difficult to answer. But the thing is that, yes, of course, all cells are active every time. But of course, whatever work you are doing, the cells which are particularly trained for that kind of action and performance, those will be more active. Whole of the brain will not be active aggressively every time.
All right, Dr. Chowdhary, to what extent does lifestyle choices, the way you lead your life, to what extent that helps in, maintaining your brain healthy?
Yeah, I think that is the most important thing, and that is a takeaway for the
Today's program,
program and general public, that you should have a reasonably good lifestyle, and that includes regular exercises, nutritious food, good sleep, which has been all told in that capsule which you've seen earlier.
Yes.
And of course, the check for the comorbidities, that you must check for your hypertension. Hypertension is number one, culprit. By the age of 30, you should at least have every year have blood pressure check at least, right? And if you are having a family history, then probably more frequently. That is very important. Secondly, of course, is that, I would not try to put it very restrictive, that don't do this, don't do that. I think moderation is the word. Even if you do, at times, some excesses, but do it in moderation. That will take care of. It balance out, right? But it is very necessary that it should be a sustained effect. And now in India, I think we are the originator of yogic practices, meditation. That will go a long way in reducing the stress. As you said, stress, tension, all that will be, highly beneficial for the general public.
All right. Dr. Achal, what advancements have been made in India with regard to treatment of cognitive disorders?
See, not particularly India, other advances have come from Western world.
Yes.
And some of the new medicines have come up, specifically if we talk of Alzheimer's disease.
And they're accessible here in India?
Some of them are available, some of them are available on demand. I mean, you can always purchase it from other country and bring it here. Some of them are available. Yes.
So you will add to it?
Yeah, so I think that, what has happened that we now are able to diagnose this neurocognitive disorders in earlier stage. So a lot of, and we also know the pathophysiology of these disorders, getting to understand better, right? For example, for Alzheimer's disease, we have got a thing called amyloid, right? Amyloid plaque. So anti-amyloid therapies have started coming in, and there's some monoclonal antibodies, as Dr. Achal has said, they're available in the West. They are started to come in India. So that will probably be useful for people who are in early stage of the disease. Not in the very advanced stage, but early stage of the disease, right? And also, I think that what has come, that a lot of gadgets are coming up, which can aid in neurocognitive enhancements, right? So I think that's an emerging field with the introduction of AI, as you know, in every field. So that is a very fascinating field where we can actually modulate the brain functions with all these AI gadgets, and and that might be of much import, because that might be cost effective and that might be easily accessible, because Indians by and large are tech savvy, so they know, most of them have smartphones, right? So they will be able to use them, and I see a great future there.
All right, so for our viewers who have in fact joined in, we are today discussing brain health, and we have doctors in the studio explaining to us how brain health can be maintained. We have Dr. Achal Shrivastava and we have Dr. Debashish explaining to us the different aspects of maintaining healthy brain. But for the benefit of our viewers, we'll have a quick rapid fire question round, wherein I'll ask you questions and you can give me crisp answers. Dr. Chowdhary, brain size determines intelligence, is it so?
Wrong.
Left-brained people are more analytic and methodological, while right-brained people are more creative or artistic. Dr. Achal, is it so?
Not true. It's more thought of than actually proven.
The human brain works better under pressure. Is it so, Dr. Chowdhary?
To some extent, there is a curve, but after that, it doesn't really matter.
Screens and gadgets can decrease brain health. Dr. Achal?
Yes, of course. Excessive use will decrease.
Alcohol leads to damage of brain cells. Dr. Chowdhary?
Yes. Again, I think I would put a clause of moderation there. A small amount of alcohol may not actually do that much harm, although that is debatable. So I would say that refrain from alcohol as far as possible.
Brain plasticity, or the brain's ability to change, peaks in the youth and declines with age. Is it so, Dr.
Correct.
Achal?
As the age advances, cells may not work properly. Yeah.
All right, so thank you so much both of you for joining us this afternoon on Wellness Watch and helping us understand better how to maintain brain health and how to be careful. So through our discussion today, we did understand that the health of our brain is the foundation of who we are, that is shaping how we think, feel, remember and connect with others. As science continues to discover the links between brain health and lifestyle choices, it becomes important that nurturing the brain is not a luxury but a necessity. Through regular physical activity, balanced nutrition, quality sleep, we can protect and even enhance brain function across the lifespan. Remember, investing in brain health is investing in the quality and longevity of the life itself. On that note, I'll end this edition of Wellness Watch here. Till we meet next, take good care of yourselves. Bye-bye.